Hello people, in this video let us look at this topic antidote. Antidote is actually one word. It is against the poison that you have taken. So it is a savior. If somebody has taken poison, what solution are you giving them, or something that will act against that, right? So the universal antidote is activated charcoal. So this should be green. So which is the universal antidote? Activated charcoal. Have you ever seen anybody being actually given this activated charcoal? Please let us know, okay? So let's start off with the first drug here. Acetaminophen, that is paracetamol. So if somebody has taken paracetamol excess, okay, if it is a paracetamol poisoning, then you will have to give acetylcysteine or methionine so that they will be able to save their liver. So acetylcysteine, methionine are antidotes for paracetamol. So it will correct the glutathione levels, correct? The enzyme glutathione deficiency will get corrected. Then coming to benzodiazepines. Benzodiazepines, if somebody has taken and it has caused poisoning, then the antidote is flumazenil. Flumazenil does what? Where is the solution? Flumazenil is going to be a receptor antagonist. Okay, so it will not allow the toxin to work. So it will block actions of toxin. So flumazenil is going to block the action of benzodiazepine. Opioids, antidote. Naloxone. What does naloxone do? Naloxone also does the same thing. It will block the receptors of opioids. Okay. Then coming to next one. If somebody has taken organophosphorus compound, what will you give? You can give pralidoxime, obidoxime, atropine. Pralidoxime, obidoxime are going to do some enzyme reactivation. Okay. Atropine is basically going to block the action of the toxin, that is organophosphorus compound. Did you understand? Then, so you should be able to tell now. Organophosphorus compound poisoning, you will give pralidoxime, obidoxime. These will do cholinesterase reactivation. What about atropine? Atropine is going to block the action of the toxin itself. Okay. Then coming to carbamates, if carbamates they take, then you give atropine. Okay. What is atropine going to do? It is going to block the action of the toxin. Very good. Okay. Next. We are moving on to the next slide here. Isoniazid. If isoniazid somebody has taken, you give them pyridoxine. Pyridoxine is nothing but vitamin B6, right? It is going to correct the enzyme. Enzyme is going to be corrected. Warfarin, if they have taken, you give them vitamin K. Vitamin also is going to correct the deficiency of the enzyme. Heparin, if somebody has taken, you will give them protamine. Protamine. Heparin, protamine. What will it do? It will prevent toxicity, okay, by binding to the toxin itself. So that is what protamine will do. Ethylene glycol. Ethylene glycol, if somebody has taken, you will give them fomepizole. What is this ethylene glycol? When do people take ethylene glycol? Some automotives will have it, looks like. You will have to give fomepizole. And what does fomepizole do? Fomepizole is going to correct the enzyme deficiency. Okay. Ethanol, which is the antidote for methanol. This is like, ethanol is like what you find in your drinks, right? So if somebody has taken methanol and it has become poisoning, then you give them ethanol, because otherwise methanol will cause blindness, etc. Now ethanol, how does it work? Alcohol dehydrogenase inhibitor. So enzyme, it's correcting, it's working on the enzyme. So it will prevent the formation of toxic metabolites. Okay. So alcohol dehydrogenase inhibitors prevents formation of toxic metabolites. Okay. Then coming to methotrexate. Methotrexate is something to do with this cancer treatment, right? So glucarpidase. Glucarpidase is again some, it will metabolize the toxin. Hydrolyzing enzyme it is. Okay. Moving on, people. Let's go here. If somebody has taken cyanide, what will you give them? Sodium thiosulfate, hydroxycobalamin, dicobalt, aditate, sodium nitrate. So are you able to see this? So what and all this will do? Let us say this sodium thiosulfate. It is going to enhance enzyme related detoxification by donating sulfur. Rhodonase enhancer. Something to do with the sulfate. Okay, it is going to donate sulfate. Hydroxocobalamine dicobalt editate. What are these going to do? These are going to be some chelating agents. They are going to bind. They are going to prevent toxicity by binding to toxin. Okay, they are going to bind to the toxin itself. That is the cyanide looks like. Sodium nitrite, what will it do? It's an oxidizing agent. It will convert hemoglobin to methemoglobin, which has high affinity for binding cyanide. Wow, that sounds scary actually. Then coming to iron. Iron, if they have taken more, what will you give? Chelating agent, desferrioxamine. Lead, if they've taken, you'll give them DMSA, dimercaptosuccinic acid. Sodium, calcium, editate. All these are chelating agents. They will prevent the toxicity by binding to the toxin, even this one. Okay. Now let us look at some strange ones which are like very rare, I think. Digoxin, you will give digoxin fab fragments, some immune something, right? Antibody fragments. Similarly with dabigatran, okay? Some antibody fragments. Then when it comes to this one, what is this? Rivaroxaban. Where do you use this? Rivaroxaban, I've heard this somewhere. Something to prevent blood clot, treat deep vein thrombosis, pulmonary emboli, prevent blood clots, Rivaroxaban. So basically, if you have taken that excess, then you have to take this as the antidote. Andexanet alpha. What a name, right? If you want, you can note this. It is a decoy receptor. Then coming to this one, aniline dyes, organic nitrates, phenacetin, sulfonamides. If somebody has taken, then give them methyl thioninium chloride. I think that's not important. Now let's just revise this quickly. Antidotes for poisoning. Universal antidote is activated charcoal. Paracetamol poisoning, acetylcysteine, methionine. Benzodiazepine, flumazenil. Opioids is naloxone. Organophosphorus compounds is pralidoxine. Obidoxime, atropine. Carbamates is atropine. Isoniazid, pyridoxine, warfarin, vitamin K, heparins, protamine, ethylene glycol, fomepizole, methanol, ethanol. Methotrexate is glucarpidase. Cyanide, you give sodium thiosulfate, hydroxocobalamine, dicobal editate, sodium nitrate. Iron, give dexferrioxamine. Lead, give dimercaptosuccinic acid, sodium calcium editate, DMSA. Okay, and some more here. Okay, that's all for now in antidotes lesson. Bye bye.